All right, good afternoon. Let's get started. Hello, my name is Tanisha Layum. I work on the Course Reporting Services team, helping out with the HSCRC quality programs. I am joined by my colleague Grace, who will be monitoring the chat, as well as, in addition to Grace, we have two colleagues from the HSCRC, Princess and Anwisha, who will go over the quality programs and answer any questions that you may have around the policy towards the end of the presentation. However, I do want to say that this webinar is focused on the Quality Financial Impact Dashboard, the report, not the HSCRC quality programs. And like I said, this webinar is being recorded, and we'll send out the slides as well as the recording at the conclusion of the webinar. So let's get started. Today's agenda will go over the background / the purpose for the Quality Financial Impact Dashboard. Princess and Anwisha will then briefly cover the HSCRC quality programs that are included in the dashboard. That I will go over a demo of the dashboard, as well as give you an idea of what is to come. The purpose of the Quality Financial Impact Dashboard is to give executive leadership high-level insight on the performance for the quality programs as it relates to dollars. On the CSR portal, we currently have a lot of reports that tell you how you're doing in the quality programs, giving you detailed statistics about that. However, none of them tie back to the dollars, which is why we created the Quality Financial Impact Dashboard to tie the performance back to your global budget. I'll now pass it over to Princess to go over the Readmission Reduction Incentive Program.
Thank you, Tanisha. Good afternoon, everyone. My name is Princess Collins, and I'm the Chief of Quality Initiatives at the HSCRC. And today I'll be presenting on 3 of the quality programs implemented by the Commission. So first, here is the Readmissions Reduction Incentive Program, also known as RRIP. And this program incentivizes hospitals to improve patient care and value over time by incentivizing hospitals to reduce all-payer, all-cause readmissions, by linking rewards and penalties to improvements in readmission rates and to attainment of relatively low readmission rates. To calculate the case misadjusted readmission rate, one would take the observed unplanned readmissions over the expected readmissions and multiply that by the statewide base year readmission rate. Expected readmissions are determined through what we call norms, which is what a hospital would have experienced had its readmission rate been identical to that experienced by a normative set of hospitals, given its mix of patients as defined by APR-DRG categories and severity of illness levels. This program assesses improvement in readmission rates from the base period, which for rate year 24 is calendar year 2018, and attainment rates for the performance period, which for rate year 24 is calendar year 2022, also with an adjustment for out-of-state readmissions. The policy then determines a hospital's revenue adjustment for improvement in attainment and takes the better of the two, which is scaled for rewards and penalties up to 2% of inpatient revenue. If there are no questions, we'll move on to impact. So the Maryland Hospital Acquired Conditions Program, also known as MHAC, is based on a system developed by 3M to identify potentially preventable complications using present on admission codes available in claims data. The methodology for MHAC program measures hospital performance, also using observed to expected ratio for each PPC. Expected number of PPCs are calculated using historical data on statewide PPC rates, also using APR-DRG categories and severity of illness levels. To calculate the final score for each hospital, the attainment points earned by the hospital and potential points for each PPC are multiplied by 3M cost weights, which is a proxy for patient harm. Hospital scores across PPCs are calculated by summing the total weighted points earned by a hospital divided by the total possible weighted points. The policy then determines a hospital's revenue adjustment for attainment with scaled rewards and penalties up to 2% of inpatient revenue. If there are no questions here, we can move on to QBR. So the QBR program is titled Quality-Based Reimbursement Program assesses hospital performance in three domains: the person and community engagement domain, the safety domain, and the clinical care domain. Each of these domains have different sets of measures, which are compared to performance standards to determine how each hospital performed. A score in the QBR program is for each domain is calculated by dividing the total points earned by the total maximum points possible. The domains are then weighted based on the overall percentage of the QBR score, which is determined by the policy. Then we, the staff, convert this score into revenue adjustments using a preset scale that ranges from 0 to 80%. And as with the previously mentioned programs, rewards and penalties are scaled up to 2% of inpatient revenue. And I saw that there's a question in the chat. No, so readmissions will be based on improvement and attainment. So whichever one you have the better of, either improvement or attainment, that's what you'll get the revenue adjustment for. And if that's all for me, I'll pass it on to my colleague, Anwisha.
Thanks, Princess. Hi, everyone. Anwisha Majumdar, Chief of Population Health at HSCRC. I will be going over the Potentially Avoidable Utilization Program, which is all about reducing potentially avoidable utilization as measured through the ARC, PQIs, PDIs, and readmissions at the hospitals. The POW program really hopes to prevent unplanned care that can be prevented through improved care and care coordination in the community. And so using the previous calendar year's performance data, a statewide cut is calculated. And then that cut is distributed to the hospitals based on how hospitals did compared to the statewide level of POW. We do use the ARC definitions for PQI 90, which is an overall composite, and PDI 90, which is for pediatric patients, and look at the readmission rates that meet the criteria for the POW program that are defined further elsewhere. If there aren't any questions, I will pass it back to Tanisha.
So the Quality Financial Impact Dashboard, also referred to as QFID, is found along with the other CRS reports in the portal at reports.cristhealth.org. Log in, go through the authentication notification, and then to find the QFID report, you navigate to HSCRC regulatory reports, Quality Financial Impact Dashboard, and then you click the little icon, the little graph icon. Here are some key features that are seen throughout the report. So one feature that's relatively new is the ability to select multiple hospitals. So if you're a health system, you can select all the hospitals in your health system, or if you want to compare yourself to your neighbor or a hospital of a similar size as you, click all the hospitals that you're interested in viewing, or if it's only one, then that's fine as well. Then hit apply, and then it'll populate the report with the numbers for all of those hospitals. Then you'll see sometimes a green to red bar. This shows how close or far your hospital is away from the reward or penalty cut point. Red indicates that your hospital is getting a penalty. Green, your hospital is getting a reward. If there's a blue area, like in the impact program, that's the hold harmless zone, meaning that you're not getting a reward nor a penalty. The report also allows you to compare your progress to a comparison year. As of today, we only have calendar year 19 and calendar year 20 data available in the report. Once we add year 24 data, you will also be able to compare yourself to calendar year 21. The report also allows you to select a month year to date. So if you want to see the most recent data, select the most recent month. You can also Excel export a lot of the data in the report, primarily on the summary pages. In the past, we called them the multi-hospital page. You can Excel export. Now we also have print functionality that's enhanced. You can print the summary page or print the details page We recommend using a larger monitor if you are printing or PDFing the reports. User communication was sent out on Tuesday to detail how to properly print. If you have questions on that, I can send out a one-pager as well. Some notes and caveats to note about the Quality Financial Impact Dashboard. The revenue adjustments are estimates, so these are not official, and it's based on the hospital's last approved global budget. Once we do have the new global budgets, we will update the report to reflect that. I think most of your hospitals do have a more accurate global budget, so feel free to use the percentages and apply that to the budget that you do have to get a more accurate representation of your financial impact. Hospitals are ranked for each quality program. Rankings are done by calculating the percent reward or penalty from the highest percent reward. Additionally, the way the report works, it's based on year to date. So if the year were to end today, where would you be in terms of your financial impact? And as of now, the report for calendar year 21 is using historical norms. We will update the report once HSCRC's policy is finalized if they're going to go with the concurrent norms or historical norms. Now, getting into the report. When you launch the report, you'll see 5 cubes. Each cube represents 1 for the totals and then 4 for each of the quality programs displayed. So if you're selected multiple hospitals, right now we're only looking at 1, the cubes, the dollars sum up to all the hospitals that you chose. So that's important to note. If you're interested in looking at a specific hospital, if you're interested in looking at a specific program, my apologies, you have to click the cube that you're interested in. Underneath the 5 cubes, you'll see, you can continue on, sorry, Grace. Also on the totals page, you'll see for the 3 quality programs that we currently have in the report, you'll see your financial impact for this year and for your comparison year. Then you can click on a specific hospital to drill down further, and then it'll list out again the financial impact for your current year, comparison year, and your percent change. POW is at the bottom because POW numbers are not included with the total financial impact because of the nature of the program. Once QBR is added to the Quality Financial Impact Dashboard, QBR will be included in that total quality revenue adjustment. Next, you can click a cube, like I said, to launch more information about a specific program. So let's go into readmissions first. So here, this is the readmission summary page. You'll see your current year and comparison year, and then key metrics that go into that. If the numbers are highlighted in blue, that means your attainment scores were the best. If your numbers are written in orange, then your improvement scores were the best. If you then want to, from there you can either print, Excel export, or go into the readmissions detail report to get more information. Another option is to launch the detail of report by clicking on a single hospital, which will launch the details page. Here you'll see detailed numbers about where you are for improvement and attainment. Then the report will take the better of the two and then rank your hospital. And I apologize, this screenshot is a little bit blurry, so I know it's a little bit harder to see, but the same numbers are available for the comparison year. And like I said, from here, you can either print or you can launch the readmissions detail of a report to see what are the factors that are playing into your performance. Next, you can click another cube. So this is the impact summary page. Again, we have our impact score, our estimated reward or penalty, and our estimated percentage, and then the hospital rank. Again, same numbers are available for the comparison year. From here, you can print, Excel export, go into the impact summary report, or launch the detailed view to drill into one single hospital. So at top, we have again, some of those same metrics as well as your hospital rank. Then we have our red to green bar to show where are we on that reward or penalty zone. We then have a observed versus expected PPC table, blue bar. So for each of the PPCs that your hospital is being measured on, they're listed below. If your hospital is not measured on a particular PPC, it will not show here at all. The blue bars are your observed, and then the orange lines are your expected. Then below that, we have our observed versus expected PPC table showing you what are those actual scores for each PPC. If the numbers are in green, then your observed was below your expected. If it's in red, then the opposite is true. And the same metrics and data are available for the comparison year that you select. Questions so far, please feel free to drop them in the chat. I know I'm going through this kind of fast. Next is the PAL program. So for PAL, it's a lot bit more data that gets shown for PAL. So on the PAL summary page, we have our avoidable admissions performance, PQI, PDI, readmissions performance, total PAL percentage, and then the dollars, as well as the hospital rank. Again, the same functionality holds true. From this screen, you can either print, Excel export, go to the PAL savings report, or launch into a specific hospital to view the PAL detailed report. So the way we chose to show PAL, because of the nature of the program, we start off with the statewide PAL revenue, showing all the PAL numbers for the entire state, and then it breaks it down into what is your hospital responsible for. And then based on that, hospitals are ranked. Next slide. And then we just have graphs that show comparing this year to your comparison year, different metrics that are involved in the breakdown for the PAL program. If there is a gray line, sometimes it looks a little bit blackish depending on the color scale, but that is the statewide. Sorry, the gray ones are the statewide, and the blackish lines are the PQI, PDI expected, and the legend is at the bottom of that screenshot. Then jumping into future state, we are working on adding rate year 24 to the Quality Financial Impact Dashboard. And once that's there, like I said, calendar year 22 data will then be available as calendar year 21 data will then be available as a comparison year. And we hope to get rate year 24 in the next coming months. And then we will tackle adding QBR to the report. I know I've been saying that for a while, but we're definitely working on that. It's just a issue with the data on the back end. And then as part of rate year 24, Readmissions program has the patient diversity index. So we'll be adding that to the Quality Financial Impact Dashboard for rate year 24, and then moving on to non-quality programs. We, in conjunction with MHA, we sent out a survey, and hospital users said that what they're really interested in seeing is market shift. So then our next goal is to add market shift to the dashboard. If you have any questions, comments, feedback, or you're saying, hey, Tanisha, CRS team, please add whatever to the Quality Financial Impact Dashboard, please email us at support@chrishealth.org. We're here to serve you and make this tool as useful for you as possible. For more information about how the measures are calculated, or if you have questions about the data, please refer to the user guide. It can be found in the portal. Just click the help button and it'll download the user guide.